My mother threw me in the bathtub, filled it up halfway with lukewarm water, and then called everybody in our family and let them know we'd be on our way to Children's Mercy in Kansas City as soon as possible. I barely remember how the rest of the night went, aside from the poking me to draw blood and the prodding me to get a urine sample. They were just trying to figure out what was wrong. Finally, after blood, urine, and ultrasound of my lower back, mystery solved. I had polycystic kidney disease. PKD is a widely unknown disorder, and I'm going to give you guys a little bit more information about it today and let you know how it's changed my life a little bit. PKD is a kidney disorder that is passed down in families, which causes cysts to form on both kidneys. It also causes the kidneys to be distended and or, same word, swollen. Your kidneys are organs in your body that filter waste and extra fluid from your blood to form urine. So it's a pretty big deal. If one parent has the gene, the child has a 50-50 chance of inheriting the disease. Someone with PKD can have an array of cysts in and around the outside of the kidneys. There are two forms of PKD, autosomal dominant PKD and autosomal recessive PKD. Autosomal dominant PKD is the most common type of inherited PKD. Symptoms can begin as early as childhood, but don't generally develop until later adulthood, 30s or 40s, and that's why they call ADPKD adult polycystic kidney disease. Cysts grow out of tiny filtering units called nephrons in your kidneys, and then eventually the cysts separate from the nephrons and they continue to grow by themselves. A cyst-filled kidney can weigh between 20 and 30 pounds and have thousands of cysts all over them. Autosomal recessive PKD often begins before birth, and the severity varies case to case. The symptoms sometimes don't occur until childhood or adulthood, but it's very rare, and ARPKD is generally referred to as infantile PKD. They use kidney imaging studies to identify cysts in the kidneys and diagnose PKD. Various imaging techniques include MRIs, CT scans, and ultrasounds. Younger patients generally have smaller cysts, so doctors refine the criteria for diagnosing PKD based on age. The slow progression of the disease can mean that cysts can grow on for years and nobody will ever know. Ultrasounds don't use dyes or radiation, so they're safe for detecting ARPKD in fetuses. Some of the symptoms: mild to severe back pain and side pain. And it's not just regular back and side pain, it's your flank, so it's pretty much right underneath your ribs. Once the kidneys have become enlarged due to the cystic growth, there isn't much room to spare, so pain in the back and abdomen is very, very common. The size of the cyst can determine if the pain is mild to severe, if it's sometimes, if it's all the time. Headaches and migraines are two of the most common symptoms of PKD, generally caused by high blood pressure. Often headaches come and go, but migraines can last for days if you're under stress, and that doesn't help with anxiety either. Most people with PKD suffer from urinary tract infections and kidney infections quite frequently. When kidney function is low or the proper diet restrictions aren't kept, such triggers like caffeine and alcohol can cause mild to severe kidney infections. Other complications caused by PKD can include blood in the urine, cysts in the liver and the pancreas, abnormal heart valves, high blood pressure, kidney stones, aneurysms, which are bulges in the blood vessels in your brain, and diverticulosis, which is when small pouches bulging outwards toward the colon start to form. There's no cure for polycystic kidney disease. Clinical studies are currently underway, and doctors do their best to help with the pain. Doctors will prescribe blood pressure medication to keep your blood pressure down. Sometimes they will do surgeries to reduce the pain, and a lot of times you'll get prescribed great painkillers. For infections, doctors like to prescribe antibiotics. Sometimes they work, sometimes they don't. In severe cases, dialysis can be used to help filter the blood. If full renal failure occurs, they will put you on a machine and they will filter your blood. I think it's 3 times a week for 6 hours a day until you have a kidney transplant. And that's just how dialysis works. Regular visits to your doctor will include getting your blood tested, getting your urine tested. Regular CAT scans and MRIs are very, very important. Also getting your ultrasounds to make sure, nothing's changed. And MRIs and CAT scans are really important to detect any abnormalities or, keeping track of the growth of the cyst. Over-the-counter drugs such as Tylenol and Azo can be used for pain. Tylenol for back pain, Azo for urinary tract infection pain. You can't take ibuprofen because it's a blood thinner, so you have to be very careful what you take. When you have PKD, it's very important to stay healthy. You have to eat appropriate foods. You have to drink appropriate beverages. You have to have meals low in fat. Have a low protein diet because protein triggers the growth of cysts. The risk of high blood pressure means you have to keep your diet low in sodium, so not very much salt. They say no caramel-colored beverages and no caramel-colored foods. PKD patients, we just can't have a lot of caffeine. I have not had caffeine for 6 years. I mean, I'll have it occasionally. I cheat, but I do not have it regularly in my diet for almost 6 years because caffeine decreases the kidney function, and since caffeine's filtered through the kidneys, it can often result in a kidney infection and a UTI. PKD patients are encouraged to drink lots and lots and lots of water and lots of cranberry juice when you're not drinking water. Exercise and sleep. Regular exercise is suggested, although strenuous exercise is not because you can end up in pain. Heavy lifting isn't recommended, and sleeping is important, but too much sleep for a PKD patient is not good. So doctors recommend between 6 and 7 hours of sleep a night. Well, guys, I really hope I've been able to inform you all today about the disease I live with every day. If your family has a history of PKD, it's really important to get yourself checked and your children, if you have children, as soon as possible so you can make the necessary changes. Because I know everyone drinks soda and I know everyone has caffeine every day. So it's really important because that can really affect you in the long run. Even though there's no cure, there's lots of hope for the cure for this disease. By making people aware of this disease, I hope all of us fighting against PKD can help make a medical breakthrough. Almost 600,000 Americans suffer from this incurable disease. That's like 1 in 1,000. The past 6 years have been the most health-conscious years of my life, and I pray every day that they find a cure.